Hi, I'm Ethan Strimling, former Democratic state senator, and this is my colleague, Phil Harriman, former Republican state senator. So Governor LePage has proposed to take about $20 million out of the Fund for a Healthy Maine. You know this very well because I think it first came to the state when you were in the Senate.
Yes.
He's pulling that money out. He wants to dedicate it to primary care for doctors. He feels that's a better way to be able to do smoking cessation in the state of Maine. There's some controversy about this. What do you think?
Well, remember when this was first settled with the tobacco companies, it was to reimburse the state for the health care costs of people who were on MaineCare. And through some strategic lobbying, frankly, a lot of the groups that were involved in smoking cessation convinced the legislature to dedicate that tobacco settlement fund to an account that the legislature, by and large, couldn't touch. And it covered a myriad of things. It wasn't just smoking cessation. It also covered things like heart-healthy menus in restaurants and a lot of other things that perhaps one might say really wasn't in the spirit of the cost that smoking inflicted on the MaineCare system. Fast forward to today, the governor is saying, you know what? We spent a lot of money in this area. I don't think it has produced the results that would be achieved if we use these dollars to support reimbursement rates for people on MaineCare and primary care physicians. How's that for covering 20-something years?
I was going to say, that's a long way of saying it, but you didn't tell us what you think about his idea. But, well, here's what I would say. Yes, it came in. I think the legislature was smart at that time because they said, hey, look, let's not just dedicate it to people on MaineCare. Let's try to help everybody get off smoking as opposed to just them, and let's focus on programs that build healthier lives. Because actually, if you live a healthier life, that will reduce smoking rates. The problem with the governor's analysis now is when you look at it, our rates were over 30% at the time the money came in. They're now below, right around 18% among adults. So there's been a dramatic improvement in terms of smoking cessation. It still needs to get better among youth for sure. But so I would say to him, look, fund primary care doctors. Nothing wrong with that. That's a huge help. But don't take it away from this. Pull it from somewhere else.
I actually think he's on the right track. We've been doing this for 20-something years. We need to keep the reimbursement rates up for doctors, particularly serving MaineCare patients in rural parts of the state. It's a reasonable explanation and I think sound fiscal policy.
You're just robbing Peter to pay Paul. Here's a better answer. Increase the cigarette tax. Increase the cigarette tax, then you're actually going to reduce smoking because we know that that's a disincentive for people to buy cigarettes, and you'd have the revenue to fund your primary care doctors. Everybody's happy.
He can't help himself.
I can't.